Welcome everyone, my name is Lars Blom and today I have this little video about superolateral fat pad impingement and jumper's knee and patella alta. You likely have heard and seen this phrase a number of times and even treated patients, and I'm sure you have wondered, why do these patients get the problem? Is it due to overload? In case, why does sedentary people also get affected? I guess for most of you the first line of treatment is physiotherapy, but is this the correct approach? Some patients, they are helped by a steroid injection, but not all, and why is it so? So I will ask the question, is fat pad impingement related to camel knee? Just take it easy. I will reveal the answer in the end of the presentation. So MRI typically demonstrate edema in the proximal part of the fat pad, and it is especially pronounced in the lateral part, and that is why it is called superolateral impingement. So in this study they found that the inflammation was related to the length of the patella tendon. And it was a similar finding in this study. In this study they found correlation to increased insult-salvagio ratio, meaning patella alta. And they also found that it correlated to a low lateral trochlear inclination angle, meaning trochlear dysplasia and lateral patella tracking. So not surprisingly, did the review and the meta-analysis come up with the same findings, that it's related to patella alta. So often the fat pad inflammation walks hand in hand with retrograde patellar cartilage changes, and this study explains why. Because if there is a little overlap between the patellar cartilage and the trochlear cartilage, the pressure per square meter increases dramatically, and the cartilage cannot stand this and gets overloaded, and the retrograde cartilage on the patella side will change into chondromalacia. This somehow corresponds to the huge pressure from high-heeled shoes that can cause damage to your wooden floor. So if the pressure is not between the patella and the trochlear, the pressure will instead be between the fat pad and the trochlear, and the fat pad becomes overloaded. Actually, there is a radiologic measure for this phenomenon, and it's called patellotrochlear index. And this measures the percentage of overlap between the patella and the trochlear. Now again, the same 3 MRI scans, and try to notice the little overlap between the patellar cartilage and the trochlear cartilage. So what about jumper's knee? Is it the same problem? At least a jumper's knee has been found to correlate to patella alta. I think you should notice this because actually patella alta predispose not only to patellar instability but also to patellofemoral osteoarthritis. So how should we treat this condition of fat pad impingement? Should we use progressive tendon loading exercises? Is rest actually better? What about shock waves or steroids or PRP injection or arthroscopic debridement or distalization of the tibal tubercle? So I believe we should take care of the root cause and bring the patella into the correct position by doing a distalization of the tibal tubercle. I do this again and again and have done it for years. Several of those I operate have for years unsuccessfully undergone the above mentioned treatments but has never been diagnosed with patella alta, despite they have camel knees. If you are a surgeon, you must be aware that this surgery is not easy, but here are some tips and tricks to reduce the risk of complication, especially to reduce the risk of patellobia and flexion problems. Strive for a 50% overlap and not more to avoid patellobia. Make a long V-shaped osteotomy using osteotomes and reduce the use of saw as little as possible, because this causes heating and can in the end cause healing problems. Use 4 3.5 bicortical screws to secure the stability and allow full weight bearing and free range of movement instead of just using 2 huge screws. If the small screws are countersunk, they will not cause long-lasting pain over the tibia tubercle. Remember to close the peritoneum very carefully to get a good soft tissue coverage. I'm sure a patient will respond positive, and likely patellofemoral osteoarthritis can be prevented. Thank you everyone, and I hope you got inspired and at least you now knows how to diagnose camel knees and will look for those camel humps in the future. Thank you.